Get started. Good morning and welcome to LPHI's June Community Health Grand Rounds. So during today's session, we'll unpack, does the Supreme Court's decision on Louisiana versus Callais affect health? And if you are unsure about the answer to that question, spoiler alert, the decision absolutely has the potential to impact individuals, families, and communities across our state and even country. So just a bit of housekeeping. Today's session will be recorded. Attendees will be muted throughout the session, but please feel free to engage in the chat or via the Q&A function. So during today's session, I'll provide some grounding, and then I'll turn it over to our featured speakers who will highlight historical examples of how voting has impacted health outcomes, and then we'll dive into the Supreme Court decision, Louisiana versus Callais, that brought us all together today, and its implications on voting rights, access, and representation in Louisiana. And then we'll talk more about how representation via the lawmakers and representatives we elect have the ability to shape health policy and how the health of our communities through a recap of the 2026 legislative session in Louisiana. We'll close by sharing resources and saving time for Q&A at the end. And I think I missed an important part. I'm Stephanie Kennedy. I'm the Senior Program Manager at LPHI on the capacity building team. So thank you all for being here today. So again, remember to drop your questions for today's speakers in the chat or use the Q&A function. So with that, I want to introduce today's speakers. So Ann Jays, Senior Program Manager for Policy at LPHI, and who I like to call one of my co-conspirators in a heap of good trouble across the state. Ann leads LPHI state and federal policy and advocacy work, which also includes working with other public health institutes across the country to build their organizational capacity to engage in policy work. Will Snowden. Will is a professor of law at Loyola University in New Orleans and the director of the Juror Project, an organization that aims to change the makeup of juries to better represent the American population and the communities most commonly accused through community and public education. Will is also an LPHI board member, where he brings his expertise to serve as our board policy committee chair. His work is grounded in a simple truth: exclusion is not accidental. And Reagan Carter, who serves as the Director for Health Policy and Governmental Affairs at the Louisiana Primary Care Association. Reagan provides leadership to the LPCA policy and advocacy initiatives and governmental affairs. Reagan is instrumental in developing and maintaining relationships with federal, state, and local agencies and community organizations, and provides project and strategic support to LPCA Community Health Center membership. So thank you all for being here today for today's grand rounds, and I'll get us started. We can go to the next slide, Mignon. So voting impacts health in so many ways, but namely, voting has helped communities secure funding for healthcare and other public services like transportation, education, and food access. When more people have the right and access to vote, this leads to policies that improve health and address the needs and desires of the communities most impacted. Being involved in the voting process and community decisions affects who gets health coverage and access to care and services. So it's not just what, but who. And representation is so important to highlight. And when we say democracy on this slide, we're referring to a system of government where the power is vested in the people by way of elected representatives. And health are connected because people need and have a right to a voice in decisions that affect their health in their communities. And I often have to check myself because in my work in public health, I usually find myself saying, I'm not really a policy person. Or if we think about it, even in our lives outside of work, how often do we hear our friends or family say, I don't do politics? But the reality is that when we engage in any part of life or society, that makes us policy people. And whether we like it or not, we all do politics. Every time we vote, every time we go to the doctor, apply for jobs, go to the grocery store, catch the bus, drive on roads or bridges, or even, I'll give you all a trigger warning, every time we pump our gas. Policies and the people who represent us have an impact on our everyday lives and health. So I've spoken enough. I'll turn it over to Ann and Reagan to highlight some historical examples of how policies have impacted the health outcomes of individuals and communities. Ann, Reagan.
Thank you so much, Stephanie. For those of you all that did not like history in school, we're going to connect history in a different way for you all this morning, just to set the background for how truly historical things, historical events have impacted voting and have impacted health outcomes throughout history, and then leading us into our topic for today. So, when we look at post-Civil War voting and investment, following the Civil War, newly enfranchised Black voters, specifically Black men, were helped to elect leaders who invested in public services, including medical care for formerly enslaved individuals. So, without this piece of history, then we would not have had voting for individuals who were able to look at what was happening in the Black community because Black men were then able to vote and were able to focus on the needs within those Black communities. Next slide. Investment in maternal and child health. When we look at through history, after the women's suffrage, states increased investments in maternal and child health. There became major contributions to the significant declines in infant and child mortality. So when we look at what happened throughout the women's suffrage and women began to vote and investing in political meetings and investing in the political process, we saw increases in maternal and child health investments and funding throughout the state, focusing on women's needs and women's health issues. Access to services and opportunities. We all know about the voting rights of 1965. We're hearing about it every day, especially as it relates to the Callais decision and what's happening specifically, across the South. But when we look at the civil rights movement was from 1954 to 1968. Throughout that movement, expanding voting rights paved the way for policies that increase funding to education, housing, economic opportunities, healthcare, including Medicare and Medicaid. All of those increases and policy focuses can be tied and connected back to the civil rights movement. So, healthcare reform, when we think about Louisiana being one of the first states that advanced the Medicaid expansion, all of that work happened from voters through advocacy efforts. And that was a direct impact on health outcomes and funding in our state. Advocates used the ballot initiatives and civic engagement strategies to advance Medicaid expansion in multiple states, including Louisiana. And I'm looking at the participants list, and many of you all that are on this call participated in those advocacy efforts around Medicaid expansion in our state. And so that is a direct connection to healthcare funding for Medicaid, expansion, healthcare initiatives, and all of that happened through the ballot and voting. For these next slides, I'm going to turn it over to my co-presenter, Anne.
Thanks, Reagan, and thank you for those examples. And so, just reiterate, I mean, truly, Stephanie said it incredibly well, but reiterating her point that our lives are political, um, that everything about our communities is intertwined with who we elect and how they represent us. And so communities with higher levels of civic participation are often more successful in securing those investments in parks and schools and transportation. And those investments influence our health outcomes. When you have greater investments in communities, you can improve physical activity, education, social connectedness, all of these things that we think about when we think about communities. And so, it is important. And we also recognize where the disillusionment in the process comes from. When people are purposefully excluded from voting, okay, you can go to the next slide. I'm going to just like tie it in. Um, and or yeah, when there's been a history of purposeful exclusion in the political process, or when you feel like your vote doesn't change anything, you can understand why people are not thrilled to participate. But I do want to share this incredible graph with you from the Institute for Responsive Gov, formerly Healthy Democracy, Healthy People. And this is a scatter plot of states and voting restrictive laws that they have on the books. And so there's this very clear, very direct correlation between states who have more restrictive voting policies tend to have worse health outcomes. And conversely, states where it's easier to vote have better health outcomes. Greater and additionally, greater voting access is linked to lower uninsured rates. So there are these like very real, very present connections with voting access, civic engagement, and health. Okay, I have one more slide. And so here are more examples from very recent memory. Communities with easier voting access experienced lower pre-vaccine COVID-19 impacts. And looking out for the young folks, civic engagement in adolescence is associated with long-term educational, economic, and mental health outcomes. So, yeah, truly the evidence is there on why these connections are so important. And with that, I'll pass it to Stephanie to move us into the next portion.
Thank you, Anne and Reagan. And I just want to make a couple of comments or notes based on what you all presented. So, Reagan, thank you for the historical examples. And I know this is a phrase that so many people use, it's an overused phrase, but if we do not ground ourselves in history or if we don't know about history, then we're bound to repeat it. We have to ground ourselves in things that have happened in the past. And also, to your point earlier, I was not a history person in school, not sure what my grades were. I may have flunked history. But now more than ever, I understand why it's important to ground ourselves in historical context. And then, Anne, I just want to say thanks for acknowledging why people might not be thrilled to participate in the voting process. If constantly I am casting my ballot, let's say I do participate and I cast my ballot for an elected official, and they don't get elected, maybe I might not feel like my vote counts. Or if I do see that the person who I voted for is elected, but maybe they're not representing my best interests. Like we know that people make promises. We say that people are supposed to represent us and our desires, our needs, our wants, and that doesn't always happen. So I just want to say thanks for acknowledging that because as we're having this conversation, I don't want it to focus on blame. There's a reason why people don't participate in the process. So I just want to acknowledge that. And also, that's not necessarily the focus of this conversation, but thank you both for that. With that, I'll turn it over to Will, who's going to share more about Louisiana versus Callais. So that's the recent Supreme Court decision on voting rights in Louisiana, and the reason that brought us all here today. So Will, I'll turn it over to you.
Thank you very much. I'm going to ask everybody to put your answers to this question in the chat box. How many seeds are in a watermelon? Perhaps you're thinking, what the hell is this guy talking about? Next question. How many bubbles are in a bar of soap? So I start with these. Well, let me give you a chance to put your answers in the chat box. As we see these answers come into either question, right, they are all different because there is no real answer. And some people are already identifying that this is a Jim Crow question, and that's the exact right direction. So there used to be things in our country as it relates to accessing the power of the ballot box called literacy tests. And literacy tests didn't only just attest a person's ability to read, but there would be these really ridiculous questions that they would expect people to answer to be able to vote. And literacy tests were one of the three ways in which Black people were often denied access to the power of the ballot box. The other two examples are grandfather clauses, which essentially said if your grandfather had the right to vote, then you would have the right to vote. But we know after the 13th Amendment abolished slavery with the exception for criminal punishment, grandfathers of the recently freed enslaved people, their grandfathers clearly didn't have the right to vote. So the grandchildren wouldn't have the right to vote. And then the third was something called a poll tax, literally something that you would have to pay to be able to vote. So these mechanisms of preventing primarily Black people in the South having access to the power of the ballot box on their face appear to be race neutral, right? It doesn't say Black people, you can't vote. It says if you want to vote in this county, you got to either pay this poll tax, you got to have a grandfather who could vote, or you have to pass this literacy test. And what the Voting Rights Act ultimately did is it recognized how these types of mechanisms prevented certain Americans having access to the power of the ballot box. And primarily, it impacted people based on race, specifically Black Americans. So the Voting Rights Act passes, and it essentially does two things. It creates a framework outlawing laws that are trying to prevent people's access to political participation based on race. And then we have these frameworks of something called preclearance, which is from Section 2 of the Voting Rights Act, which I won't get into because that case was decided many years ago, called Shelby County versus Holder. And then we have Section 5, excuse me, that was in Section 5. And then we have Section 2, which was present in Louisiana versus Callais. The issue with Louisiana versus Callais as presented to the United States Supreme Court was whether or not this new map that created a second majority Black district in the state as it relates to our congressional representation, Louisiana has 6 different districts, whether or not the creation of this second majority Black district was constitutional. The proponents of this second district were using population numbers as the justification. And some of you might remember there were a lot of folks who were saying 1/3 of 6 is 2. And what that tagline was referencing was that Black people now make up 1/3 of Louisiana's population. Therefore, the political representation should translate to 2 congressional districts. And we went through a lot of different iterations of maps to create these different districts, and it was done through what is called gerrymandering. And gerrymandering, for many of us, seems like a very unnatural word because it is. It's a word that was made up in response to a governor who was a signatory of the Declaration of Independence. His name was Elbridge Gerry out of Massachusetts, and he wanted to kind of disempower his opposing political party. And so when he drew these different districts in the state of Massachusetts, his opponents said that one of the districts looked like a salamander. And so what they did is they took his last name, which was Gerry, and they took the reptile salamander and they fused it together to say, we're going to describe this practice of drawing district lines in a really weird way as gerrymandering. So there's 2 types of gerrymandering. One is called a political gerrymander. The other is called a racial gerrymander. Political gerrymandering is allowed only because it is not reviewable by the United States Supreme Court. So the United States Supreme Court has created different doctrines. They're called justiciability doctrines. And these doctrines basically create the framework for what types of issues the Supreme Court can consider. And one of the issues they cannot consider are matters relating to politics. That is an authority designated to the states for drawing district lines, but also the legislative branch. And so if somebody wanted to challenge a political gerrymander, the Supreme Court would say, this is not an issue that we have jurisdiction to review. The other type of gerrymandering is called racial gerrymandering, and that is an issue the United States Supreme Court can review because it is alleged to violate the 14th Amendment of our Constitution, which has a clause called the Equal Protection Clause, which basically says everybody in our country, we all are protected by the laws equally. And if this racial gerrymander, if this district that's drawn along racial lines violates the 14th Amendment, then the United States Supreme Court can review it. So Louisiana versus Callais, the state legislature drew a second majority Black district. And some of us might be asking, well, why are we drawing district lines based on race? And that's a very good question. In Louisiana, there is a very unique overlap between Democrats and Black people, meaning that there is a high number, majority of Black people are in fact Democrats in the state of Louisiana. And so since there is this overlap, as part of apportioning more political representation for Black people who also have a high likelihood of being Democrats, that was the advocacy to have this second majority Black district, which would also create a second district for the Democratic Party, because it'd be very likely that a Democrat would be elected to represent that district. So the issue in front of the United States Supreme Court is, can Louisiana draw a map creating this second district that is based off of race? And the Supreme Court says no. The Supreme Court says the Voting Rights Act, specifically Section 2, does not A, require Louisiana to draw a second district, and B, what did I say? A or B, or one or two, and then two, I think I said B. So the second thing the Supreme Court said is that you cannot draw lines based off of race. So one, they're saying, hey, the Voting Rights Act doesn't require you to create a second majority Black district just because the Black population has increased. And then two, if the state has decided to draw a second district, that district cannot be drawn along racial lines. And so the Supreme Court rules that this is a racial gerrymander and therefore is unconstitutional. So what is the impact of this ruling? Well, for me, the biggest harm that I have seen from this decision is Justice Alito, who wrote the opinion, and the opinion was 6-3. So the 6 conservative justices voted to deem the map unconstitutional. The 3 liberal justices disagreed and they dissented. In this opinion, there was a case called Jingles or Gingles. And the whole point of the Gingles case, it says, when you are trying to assess whether or not racial discrimination is present, you do not have to only rely on discriminatory intent. If you can recognize by the data that there is disparate impact, that is enough to satisfy the representation of discrimination. So I want to give you an analogy. And the reason why this is important is because the harm is the same. Whether the legislatures intentionally were trying to discriminate against white people or Black people or whoever it might be, or if they were unintentionally trying to discriminate against these people, we can agree that certain groups are being discriminated against and the harm is the same. So I want to give you an analogy to cement that understanding. I used to live in New York. When I first moved to New York and I got on the subway for the first time, I was not prepared for when the subway starts to move, it kind of has a little jolt. And so everybody kind of rocks a little bit like that. I'm 6'1", about 200 pounds. And when that jolt happened, I lost my balance a little bit. And when I caught my footing, I stepped on this woman's toe. And so that was 200 pounds on her toe. And she was, wincing and grimacing because I had hurt her toe. And I felt really bad, right? I hurt her. That harm would not be any different if I walked onto that subway and I intentionally stepped on her foot. The harm is the same, right? In the first example, I didn't mean to hurt her foot. In the second example, if I come on and I step on her foot intentionally, I intended to hurt her foot. It doesn't matter. Either scenario, her foot is hurt. So the problem with, from my opinion, when Justice Alito gets rid of this Gingles framework, which says you don't have to identify discriminatory impact, you have to identify discriminatory intent, it now makes it very, very difficult, if not near impossible, to prove racial discrimination, since the requirement to prove racial discrimination in this context of gerrymandering requires proof of racist intent. And Justice Alito says, if you can see emails or text messages or commentary made during a committee hearing at the state legislature, that's the type of evidence of discriminatory intent that would satisfy this test. But we know that racism evolves over time. And what our grandparents' racism may have looked like was very explicit. What our racism looks like today is much more implicit. So the fact that we are trying to resort to a very old test to identify modern day racism, it's never going to work. So the impact that the Louisiana versus Callais decision is having, it's making it much more difficult to prove racial gerrymandering. And it says that racial gerrymandering is acceptable if it can be explained away as political gerrymandering, because political gerrymandering is allowed. And so if I redraw the map of Louisiana and I want to politically give power to Republicans and preserve incumbents in the state, that is allowed. That's part of the game of politics. And if, in fact, when I am drawing this map in a way that disenfranchises minority populations, that doesn't matter. That's just a collateral consequence that is not unconstitutional. So what we see after Callais decision are different states now going through redistricting, because in the fall we have what are sometimes referred to as the midterm elections. Senators and representatives are going to be up for election. And if they can apportion the districts in different ways, different parties, meaning the Republican Party or the Democrat Party, can either gain seats or they can lose seats. So that's the impact of the Louisiana versus Callais decision. This directly transfers to who people are able to elect to represent them in our systems of government. And as the previous speakers explained, there's a direct correlation between our political representation and overall health in our states. Back to you, Stephanie.
Thank you so much, Will. And I'm not sure if while you were speaking, you had a chance to view the chat, but a lot, excuse me, a lot of engagement in the chat, first from your opening questions. And some people were able to pick up on what those questions, or where they derive from. And then also a lot of people said this was new information for them, particularly around gerrymandering and the origins of that word. I just wanted to highlight one thing, and it might have been glossed over in all of the great information that you shared, but you mentioned the word collateral, in the context of like the intent versus impact that certain decisions might have on people. And the idea that lives, health, livelihoods are just merely seen as collateral damage. And some of these decisions really underscores the need for us to, if even if not participating in the voting process, but staying engaged around this conversation, that sometimes our lives can be seen as collateral, and that's okay and perfectly acceptable, even though we know that it's not. So I just wanted to highlight that piece. But thank you again for kind of breaking that down in plain language for us. Um, and I want to loop back to my opening when I gave very abbreviated definition of democracy. So again, when we were referring to democracy, we're referring to our system of government where the power is vested in the people by way of elected representatives. So there are people who we elect to represent us, and those people make both federal and state laws that should serve in the best interest of the people who they represent. And so, for those who may not know, every year for a few months during the spring and the summer, sometimes multiple times throughout the year, Louisiana has its legislative session. So, when those representatives go to our state capitol and make laws. So, what I want to do now is I want to turn it back over to Ann and Reagan to share maybe just some examples of things that happened during this legislative session, which just ended, I think, June 1st of this year. And I really want to highlight, or I know we're going to frame this conversation around these are the things or the topic areas that were up for discussion. So these are the areas of our lives where our elected representatives had the ability to either make laws or policies in or against our best interests. So I'll turn it back over to you, Ian and Reagan.
Thanks, Stephanie. And I think the first thing I want to highlight, and it's not on the slides, so is that our state legislature is the one, to Will's point, who, during our state legislative session, which just happened from March to June in Louisiana, are the people that we elected to represent us in the House and the Senate in Louisiana were the ones who redrew our congressional delegation maps in the wake of the Callais decision that eliminated one of the minority majority districts. And so that was, I think, one of the biggest outcomes from the state legislative session. And these are the types of topics that the people that we elect for these positions get to make decisions on. And so that happened this session. And there were important health wins that this legislature also passed. And so I want to share some of the victories around health this session, again, as an example to Stephanie's point about um, what we can accomplish when we advocate together and to check in around the decisions that get made on the state level. I'll share from my experience. So I do this work. I've been at LPHI for 4 years now and was working at the state legislature before that. But it wasn't that long before I started working in this world that I even like truly understood the concept of a state legislature. If you had asked me before I started this work who my elected officials were, couldn't have told you. Like, I don't know that it makes its way into our consciousness much. And it could have been me just being out of touch. Um, and so it's easy to find it irrelevant or find it not relevant to my personal daily lives. But some of the stuff that we worked on this session and passed around the health stuff really has implications for us on our health, on a health level. So LPHI works with the Time to Care Coalition. I know many of the people who are listening right now had a hand in helping pass Senate Bill 157 on paid parental leave for our K through 12 educators. Our vision is a world, a Louisiana, where everyone has access to paid family medical leave when they need it. And there are many other states who have passed full paid family medical leave programs, and we are working on incremental progress towards that vision. And so, an important step forward this year was getting this bill, this policy passed. It's not over yet. We still need to find funding to actually implement, but a huge hurdle. And there's so much evidence that shows that paid leave, paid parental leave has dramatic impacts on overall family health, the health of moms and babies. And so it was an important step forward. We also started wading into healthcare affordability and this issue of medical debt. It's a huge problem in Louisiana. Louisiana residents owe billions of dollars in medical debt. And so we really worked with American Cancer Society and the New Orleans Health Department to try to start again with this incremental progress on alleviating some of the burden of medical debt. And so we successfully passed Senate Bill 414 with Senator Talbot, which caps interest on medical debt at 3%. Again, this is a first step in a larger body of work with many interconnected players that will continue to be an issue in Louisiana year after year. And the people that we elect get to make those decisions. Another win and important step forward was House Bill 22, which requires Medicaid to cover dental procedures for certain. I think the way that the bill ended up being was for certain medically necessary procedures. If you needed to have a medical procedure, needed to have a dental procedure in order that you could have the next medical procedure. You'll hear a theme of like incremental progress first step, but another win. Okay, let's look at what else happened. So let's go to the next slide. The oh, There is a missing one right before this one? There we go. So another part of the work that we do at LPHI, work in coalition on everything that we do. Um, the last slide was more proactive policies, and this slide is more defensive policies. And so some of the health bills that would have negatively impacted health outcomes in our state, a broad coalition working on many of these. These look like mostly the vaccine ones. But I'm telling you, vaccine infrastructure had a great session this session because there was a bill that would remove meningitis requirements that failed, that would prohibit public entities from quote unquote discriminating based on vaccination status that failed. And this other like wonky bill, which would prohibit financial incentives or penalties to encourage healthcare administrators to administer vaccines, which also failed. So those are some of the things that LPHI was working on this session that impacts our health. And now I'll pass it to Reagan to share what LPCA was up to.
Thank you so much, Anne. I appreciate that overview. Before I dive into one of our major bills for this session, I appreciate you sharing the bills that also failed. A lot of times we focus on the celebrations of what passed, which is what I'm about to talk about, one of our bills that passed. But being on the defense and ensuring that bad legislation fails is such an important part of our policy work because those bad bills could have such detrimental impacts on our state that it is great to acknowledge when we successfully defeat some legislation. So thank you for including that, and specifically using the examples of the vaccine bills, because as our FQHCs, we are very, very proud to support and advocate for individuals to have access to vaccinations. So for LPCA, one of our major priority bills that we spent a lot of hours focusing on was House Bill 1249 related to school-based health centers. And we worked with Representative Stephen Jackson out of Shreveport. Just a little history around why we thought that this bill was important is because we have 208 school-based health center sites across the state. So our FQHCs operate over 200 school-based health center sites across the state, serving students from pre-K all the way through the 12th grade. And we were finding that within some school settings, that school operators were creating separate policies that was making it difficult for students to actually access the school-based health centers. So even though those school-based health centers were right there on site, we had some school operators that were developing policies that might say something to the effect of a student can only go to the school-based health center before school. Well, what if their bus is late and they cannot get there before school, or students can only go after school? Well, if they ride a bus, they have to get on the bus on time. And so what we did was we worked with the School-Based Health Center Alliance, our FQHCs, Representative Jackson, and many other advocates, including you all on this call, to make sure that if a school-based health center is on a school campus, that a school could not create a policy that would prohibit that access. And so we were really excited to see all of the support for the bill. We ended up having support from the Principals Association and the Superintendents Association, and so successfully crossed the finish line for our bill. So just a little bit about our data for school-based health centers. We served around 31,000 students last year. Those 31,000 students had over 100,000 medical visits, around 89,000 behavioral health visits, and of note, about 66,000 of those visits were uninsured. And in a school-based health center, you do not receive a bill for any of those services that you receive in a school-based health center. So what do we do in school-based health centers? Immunizations, which is why those bills that Anne highlighted was so important. We do tobacco screening, HIV screening, depression screenings, child weight, nutrition, BMI, physical activity, and then we have a high rate of asthma education and students with asthma in our state. And so we have specific protocols for those students in schools. So we are really excited to have our school-based health center bill. Stay tuned to LPCA's weekly newsletter. We will be talking more about this bill and how we're going to make sure that it is honored and implemented to protect students' access to school-based health centers in Louisiana. So just an overview of how we support civic engagement, reconnecting us to how voting impacts our health and making sure that our health center patients, our health center board members, our CEOs, and everyone is engaged. We have the Louisiana Primary Care Association, LPCA Action Network. We have monthly meetings where we convene with our advocates, give them updates on what's happening, not only on the state level, but also federally. This past legislative session, we sent out several action alerts, and over 1,500 actions were taken during legislative session. And then on the national level, our National Association of Community Health Center actually gives out Advocacy Center Excellence Awards. We call them ACE. And so it gives health centers an award during National Health Center Week. You'll see that there as well, August 2nd through 8th, acknowledging their engagement in that legislative and advocacy process. And then our LPCA annual conference is coming up. It's October 20th through the 23rd. It will be in New Orleans. I encourage you to go to our LPCA website. We're still accepting speaker abstracts, and we encourage you all to register and attend. Anne is very familiar with our conference. We usually do a session or a pre-conference, and so I'm sure that we will both figure out how to be there talking about this again. And I've kind of gone over some of that for our conference and our action alerts. So I'll turn it back over to you, Anne.
Yeah, thanks, Reagan. I think it's hard not to hear some of this information and want to do something about it. And so I do, Reagan mentioned her newsletter, LPHI has a newsletter. The Power Coalition for Equity and Justice does a ton of work in the civic engagement space. I really encourage you to check out their stuff. They're a really powerful organization doing work across the state of Louisiana. And I think we'd be remiss if we didn't say register and vote. We've got an election in New Orleans on Saturday for, I guess it's a statewide election, for the primaries for the Senate election. And there will be more elections coming out throughout this year. So truly voting is a first step. It's not the only step, but one of the first. And so those are the resources there. So with that, I'll pass it back to you, Stephanie.
Thank you, Anna Reagan. And we will make sure in our follow-up um, to send out all of the resources, Reagan, that you shared. Hopefully, we can send out a link to sign up for the LPCA newsletter as well so we can stay informed. I mean, I really did want to just take a moment to acknowledge, again, we were talking about in Will's portion of the presentation about impact, whether it's like intentional or not, but the impact we talked about collateral, and then the win around school-based health centers and the potential to impact 31,000 lives of children. And I think it's really important to highlight because when we talk about who's impacted, you are talking about children who sometimes can't make decisions for themselves. They rely on their parents, or maybe not. And the idea that your advocacy, or even that it was up for discussion, that the lives and the health of 31,000 children were kind of on the line, was a big deal. So to me, that's a perfect example of the impact of the advocacy work that you do, or the impact that our representatives can have on lives and health, and not just for adults. I think we think about ourselves, but for children in our state. So that was really important to highlight. Thank you, Ree. All right, we are at 11 o'clock. Thank you all. Thanks to our panelists, Will, Reagan, and for sharing today and being with us today. Thank you for all who attended. Please feel free to fill out the evaluation. It's very brief. We just want to know if this was useful or how we can improve for future sessions. Please make sure you come to our next grand rounds. Next session is actually July 25th. at 10 a.m. So sorry for that error. We'll make sure we send that out in our follow-up. So we will send out an evaluation survey. We also will send out some resources, everything that was shared today, in addition to some others. So thank you all for being here. Y'all have a great day.